Dr. Larysa Dyrska is a board-certified pediatrician and an advocate for children on the issue of fracking for oil and gas. Together with fellow New York medical colleagues, she founded Concerned Health Professionals of New York and has been involved in the production of 5, and counting, editions of their compendium of scientific, medical, and media findings demonstrating risks and harms of fracking. She is also on the executive board of Physicians for Social Responsibility, New York. Please welcome Dr. Larysa Dyrska.
I'd like to focus this presentation on, next slide. I will. On children, their unique susceptibilities, including from exposure to fracking toxins. And I ask for your consideration if you're in a position to make policy and in your practices. So I've worked as a pediatrician all of my life, and I also have had my own children and grandchildren. And I found that all too often, children, although they're the largest vulnerable population, are mostly ignored in discussions concerning regulations, and that includes environmental laws. Thanks. We do this work because we all have children in our lives, whether they're our own or our grandchildren, or simply because we care about the legacy that we leave for them. And much of this presentation is going to be based on a series of peer-reviewed publications which address the unique vulnerabilities of children and how certain chemicals used in the oil and gas industry could affect them. One of the questions our working group that put together these papers asked was, what are the effects of pollution, especially air pollution, on children's brain development? Research we compiled showed that prenatal and early childhood development exposure to certain air pollutants is associated with developmental delays, reduced IQ, symptoms of anxiety, depression, and inattention. Research that we compiled has linked air pollution with preterm birth and low birth weight, and those are known risk factors for a variety of developmental disorders in children. And exposure to air pollution in early life can affect brain function across their whole lifespan. So this is not just a one-time insult. It can affect them for a pretty long time. Some evidence suggests even that prenatal exposure to air pollutants can be a risk factor for autism spectrum disorder. Dr. Frederica Pereira of Columbia University has written that as many as 1 in 6 children has a neurodevelopmental disability in what's been called a silent epidemic. And even at very low levels, air pollution can have lifelong health consequences when these brain drain chemicals, as they're called, are encountered during the critical first 1,000 days of life. That's the period when brains are developing most rapidly and in a precise sequence that's easily disrupted by chemicals or other stressors. Almost 90% of the global disease burden related to climate change is borne by children. The perinatal period and childhood are times of that rapid growth and development accompanied by changes in organ system functioning. There are also changes in metabolic capabilities, physical size of the child, and behavior that can dramatically modify the effects of toxicant exposure. Given that same amount of exposure to a toxicant, people will vary in how susceptible they are to disease, because there are factors affecting susceptibility, which include their genes, sex, age, nutritional status, their state of health, so coexisting conditions, and biochemical differences like their metabolism, speed of the DNA repair, and cell growth. And children's behavior results in differing exposure. Children have increased exposures because of their physiologic needs, which are greater in children for food, water, and air compared with adults. Their metabolism is different from adults in the greater absorption and retention of toxins, decreased ability to detoxify and repair. Their immune systems are immature, and there's a higher rate of cell proliferation. And because of their young age, they have many more years to develop disease. There are age-specific periods of susceptibility, which are called critical windows of exposure or windows of vulnerability, and these are times when children are exquisitely sensitive to any adverse effects of chemicals. The rapid growth of and development of their organ systems makes children vulnerable when they're exposed to these environmental toxins. These critical periods vary according to each organ system. For an example, the central nervous system develops over a protracted period. Neuronal cell division is thought to be complete by 6 months of gestation, but CNS development continues to involve time sequences of cell migration, differentiation, and myelination until adolescence. In fact, CNS development may not be complete until children are in their mid-20s. Parental exposures before a child is conceived can result in adverse reproductive effects from toxins that are endocrine disruptors, and the effects can include infertility, genetic damage to the fetus, possibly resulting in birth defects, and other toxins induce abortions like toluene. I wanted to call to your attention this article by Elise Caron-Boudouin that took actual measurements of BTEX metabolites in pregnant women. And it was a pilot study from British Columbia, and they evaluated gestational exposure to benzene and toluene in northeastern British Columbia. They documented higher levels of a metabolite of benzene in the urine of these pregnant women, suggestive of a higher benzene exposure in these women who participated in the study compared to the general Canadian population. In infants, toddlers, and young children, increased exposure can arise from their normal development, like the hand-to-mouth behavior in toddlers. In addition, breastfeeding infants can be exposed to the lipophilic contaminants in breast milk. An infant's respiratory rate is more than twice that of an adult, so they breathe in more of the contaminants. In the first 6 months of life, children drink 7 times as much water per kilogram of weight compared to an adult. And some toxicants are more readily penetrate children's skin, especially in the newborn period. Physically, children are short, and they live and play closer to the ground, and that's where most of the contaminants are found. Young children aren't mobile, and they rely on adults to remove them from hazardous exposure in the event of some sort of situation that could increase their risk, but that increases dermal exposure and absorption. And as children mature, they become progressively more independent, and that presents new opportunities for exposure to hazardous substances in play settings and in schools. As an example, from ages 1 to 5 years, children consume 3 to 4 times more food per kilo of weight than do adults. Behavioral factors include oral exploratory behavior in infants, hand-mouth behavior, pica, and children just don't wash their hands. And of course, they're curious. Children's long life expectancy increases their risk. Some of them have a long latency period. And nothing more than just being an adolescent may result in toxic exposures. They may start working. There's increased mobility and exploratory behaviors in school-age children and adolescents. And puberty also results in rapid growth, cell division, and differentiation of many cells, and could result in additional vulnerabilities. And then oil and gas industry presents us with new combinations of toxins, which have yet to be explored. Theo Colburn and her colleagues at the Endocrine Disruption Exchange have done groundbreaking work on endocrine disruptors, and we'll hear more about that later. But recently, a team of researchers led by Susan Nagel at the University of Missouri reported a variety of potent endocrine disrupting properties in 12 chemicals commonly used in drilling and fracking. A group, the group that Sandra Steingraber and I co-founded, Concerned Health Professionals of New York, commented on this paper on endocrine disrupting chemicals. We thought it was significant that of the 700 plus chemicals that can be used in drilling and fracking operations, more than 100 are known or suspected endocrine disruptors. Endocrine disruptors are unique among the toxic agents in that they interfere with hormonal signals and can alter pathways of development, even though the exposure may be early in life or even predatally. Of concern is they documented potent endocrine disrupting activity in ground and surface water supplies in Garfield County, where fracking chemicals are known to have spilled. The level of chemicals was enough to interfere with the response of human cells to male sex hormones, as well as estrogen. And there were 5 samples taken from the Colorado River, which provides water to more than 30 million people, which showed estrogenic activity. So there are public health concerns. The respiratory system is highly vulnerable to environmental toxins during development, and the exposure to the chemicals used in fracking, and the examples include ozone, particulate matter, silica dust, benzene, formaldehyde. They're covered in the paper that is cited here, are linked to adverse respiratory health effects. We found in our paper that there are elevated air pollutant emissions in areas with unconventional oil and gas development, that there's a growing number of epidemiologic studies indicating oil and gas development being associated with adverse health impacts, and that includes increase in adverse birth outcomes, increased hospitalization rates, and complaints from residents. The International Agency for Research on Cancer has classified outdoor air pollution as a carcinogen. And benzene and formaldehyde, both fracking chemicals, are also carcinogenic. And particulate matter, just one of the criteria air pollutants, besides being a carcinogen, further impacts children's health because it leads to an increase in overall morbidity and mortality in all age groups, and it causes a decrease in lung growth in children 10 to 18 years of age. The other paper that I'm citing here is the neurodevelopmental effects of fracking chemicals on children. And there's a strongly established connection between toxic air contaminants and neurodevelopmental problems. The purpose of our paper was to highlight how newborns and growing children may suffer from exposure to unconventional oil and gas related air and water pollutants. And we looked specifically at 5 neurotoxicants that affect children, that included heavy metals, which were arsenic and manganese, particulate matter, BTEX, PAHs, and endocrine disruptors. And we found that these 5 pollutant groups are associated with neurotoxicity, neuroinflammation, psychomotor effects, and neuromuscular effects. Some of these pollutant categories were also linked with neural tube defects and neurodevelopmental effects like impaired memory, intellectual function, learning, and cognitive function. ATSDR refers to this as the exposure disease model. I'm not going to spend too much time on it because I'm not an expert in this aspect of the exposure pathway. But suffice it to say that this is something that you'll at least hear about, and some of our speakers have touched on this. How do you conclude that there is a pathway of exposure that can be proven? In an ideal setting, there's a source of contamination which you can identify. In this case, it would be a fracking site or industrial emissions from a power plant. There's a medium and a way to transport it. like water or movement through a groundwater aquifer, a point of exposure like a private well, and a route of exposure, such as eating, drinking, breathing, touching, or even transplacental exposure in the case of children. And there has to be a receptor population. And children are more susceptible to these environmental toxicant exposures based on their increased exposure risk. So I'd like to speak a little bit more about why we don't know more and why more of these pathways aren't closed. Healthcare providers have to deal with proprietary chemical information. So in Pennsylvania, there was an act that restricted, that was rescinded, so it's no longer in effect. But for a while there, healthcare providers could not share medical information that they obtained from proprietary chemicals that made their patients ill. And there's also a lack of transparency and research barriers. There's exemption from several parts of several environmental and public health laws that would be normally protective of the environment and of public health, and those were changed during the 2005 Energy Policy Act. And so a number of the chemicals associated with unconventional oil and gas are not reported to the public. There's a lack of peer-reviewed data, and that's per the EPA. Then there are non-disclosure agreements. So when the industry knows that they're definitely liable for someone's illness or property damage, they have the residents sign a non-disclosure agreement with the oil and gas company, and that prevents the residents from sharing their information with their neighbors or advocacy groups and also with researchers. But on the positive side, to lead to perhaps some closure of a pathway of exposure, you can obtain some data about spills, about the number of wells, intersections of pipelines and compressor stations, the build-out, general build-out from places like SkyTruth, Frack Tracker, and even on the Colorado oil and gas site, you could see where the gas wells are. So this just tells you that if you have all the elements, that's the green arrow, you get a completed pathway. Very hard to do. On the right is incomplete data, and so you have what's called an incomplete pathway, and on the left is one that's not verified, a pathway that is not proven. Despite this lack of actual documentation that a fracking site or an industrial site has caused some illness, we know a lot. The scientific literature now includes about 1,678 peer-reviewed studies on the impacts of fracking. That's on the right-hand side, the total number of peer-reviewed. And that's documented on the PSE for Healthy Energy's repository for oil and gas energy research. And on the left, you can see the number of articles that have come out every year. And that curve is exponential. So I'd like to also call to your attention again the compilation that Sandra mentioned, which is the compendium of findings, research findings on the health impacts of oil and gas exploration. And it's downloadable and accessible to everybody. Just to reiterate also very briefly, once Dr. Zucker, the Commissioner of Health in New York, reviewed all of the information, he recommended that fracking be banned in New York State. He said that it would be reckless to proceed with high-volume hydraulic fracturing in New York until more authoritative research is done. Based on a lot of the things that you've heard today and some of this information, what we would suggest is increase the setback distances from oil and gas development. And that's to include those, I believe Raina said 9 million children who live within half a mile of a fracking site, whose schools are. So we need to assess what that health burden is. The research is really growing, but we need to have even more that connects the dots. And even though we know so much, government should be able to take a precautionary approach, and we should be encouraging them to do that. And for practitioners to take a thorough look at the environmental history and using those toolkits as proposed by Environmental Health Project. And I'll end it on that.